Pharmacy has been something that I've worked on for a lot of years and something that we have had so many problems with in the past, and inaccuracies and the amount of medications we're delivering and everything else that we're doing in corrections specifically has increased for so long that we needed a solution outside of what we've developed so far. It became clear to us that there was very few companies that could even come close to what we were looking for, and both Talyst and Talyst stepped forward with the hardware and the software and the service pieces that we needed in order to make this a project. With remote dispensing, with a packager at every location, what I'm getting is great healthcare. The idea is not just accurate dispensing and not just the right jug to the right patient at the right time, but what in corrections, which is very, very difficult to do, is that now I am able to be in a position where I am giving the next dose due. So when the physician orders the medications, they write the orders, we put it into the system, it goes through, it gets approved by the pharmacy, is that it is available in the packager to deliver to the patient at the site of where the patient actually exists. It's very difficult to hire nurses, and it's very difficult to keep them on when I'm expecting them to pass medications to 300 patients over miles of walking and delivery of pharmaceuticals, and I expect them to do that at 100%. It takes 4 nurses in this one facility alone, 3 hours each to set up their medications and then to go pass their medications. So they're getting in here and they're working really hard and they're getting all their medications out, and the medication packager that we've chosen through Talyst can deliver it for my entire facility in less than 30 minutes. So this is our medication packaging room. It's a very small little area, but it is very functional for what we need to do, because generally the people that are working in here aren't going to be here that long. With these 2 pieces of equipment, we can run what all those nurses were running and would take 12 hours for the 4 of them to do, we can do in less than a half hour. Basically, the way we used to order medications is the physician writes it in the medical record right here, and then a nurse takes off the order. We were entering into the old system, and then it would get faxed over at one time or another, and then a pharmacist on the other end, not taking our original data, they would then take up a print up of what we put in there and then re-enter that into their foundation system. But now our current process, what we're gaining so much in is that we're able to enter directly into a system that is then being read at the other end by the pharmacist the exact same way that we entered it in. Instead of us putting it in, possibly making a mistake when we ordered it in the first place, possibly faxing over something you could not read, is that we're typing in orders that are directly transmitted into the same system. They don't even have to open up. It's all there in a queue for them waiting to approve the medications. Then when they approve the medications on their end, then it's immediately available in our packager for the next dose due. So here's our canisters right here. Is that inside here's a little chip that says exactly what medication it's on. There's a label that says what it is, and then there's a seal right here that the pharmacist signs and says that it is this medication inside this canister. And then all we do, scan it in. We try to keep it very simple, set it in any one of these areas right here, and it's ready to go. Since we have a large volume of medications going through our facility and a large potential need for canisters, is that we opted for a carousel as well. What the carousel does is that we're able to have backup canisters for each one of these sent to us by the pharmacy based on velocity. The machine decides how much we're using of any particular medication, and then the pharmacy automatically sends it to us. So we never even have to order backup canisters. We want to know exactly where all of our medications are. We've never had that capability before. We always guessed, we always ordered, and we got what we thought we ordered, and we would check on this hand sheet. But what this gives us instead is when we scan in the medications and in the canisters, we know down to the pill where every pharmaceutical is. With Talyst and Talyst, it was completely correctional based. It was something that it was completely different in the market, and we developed something that can now be emulated. Good luck to anybody, and anybody who wants to come down and take a look at it. We're always open for that kind of thing. We always share as a community for healthcare and corrections specifically. So come down and take a look at it and see how great it works.